Will prior authorizations for original Medicare soon be required? Yes and no, but it's probably not as big a deal as you might think, and certainly nothing to panic over. In this video, I will talk about this new trial program for prior authorizations in original Medicare and what it means for all of us on original Medicare in the years to come. I'm specifically referring to Medicare's new pilot program on prior authorizations that starts in January of 2026. And we've received a number of questions on this subject that will be answered in this video. I will cover why the prior authorization program was initiated and what you can expect in the years ahead. So don't go away. Hi, I'm Matthew Claassen, CEO of MedigapSeminars Insurance Agency. We help people with their Medicare and retirement decisions in 49 states. Please reach out to us by using the Contact Us link below or by calling our office using the telephone number in the upper left, I believe it is, of this video. And it will also be in the show notes below. This is going to be an interesting video on a subject that triggers a lot of emotion. So let's start here with what health conditions original Medicare covers. The intent of original Medicare is to cover everything medically necessary to diagnose and treat any disease, condition, or injury. It's that simple. But the key term in that mandate is medically necessary. Medically necessary means that the procedure is safe and effective, not experimental. Clinical trials are an exception to that, and that the procedure is accepted and furnished or delivered in accordance with the accepted standards of medical practice. If a procedure or service treatment meets the requirements of medical necessity, original Medicare will cover it. Medicare Advantage plans replace original Medicare and are supposed to also cover everything that is medically necessary. But they found a way around that with the abuse of prior authorizations. In health insurance and as a Medicare recipient, when we hear the term prior authorizations, it brings out a lot of bad emotions like frustration and fear and makes one eye twitch. That's because Medicare Advantage plans have been using prior authorization requests to deny or modify the services recommended by your doctor. The insurance company motivation has always been one of profit, because they are paid a flat monthly fee by the U.S. government based on your health history. The more medical claims they can modify, exclude, or prevent, the more money they make. So for those of you on the edge of your seat wondering if original Medicare is going to make our lives miserable by denying coverage for medically necessary treatments, let me put that fear to rest. Original Medicare has had a very limited prior authorization requirement since 2014. This prior authorization requirement has mostly focused on some durable medical equipment with the intent of reducing waste and fraud. I will repeat that. The primary intent of original Medicare's prior authorization program is to reduce waste and fraud by the medical community. What is this new Medicare pilot program that starts in January? I'll cover that next, but first, I need a favor from you. Our videos are not being shared by YouTube like they used to be, but please help us out. Press the like button below and tell us in the comments section how you feel about prior authorizations. Anyway, doing that will help tell YouTube to share this video with others researching Medicare. Thank you. As I mentioned, Medicare has a new prior authorization program that will start in January of 2026 for only a few select states, and more on that in a moment. The program is called the Wasteful and Inappropriate Service Reduction Model, or WISR for short. Here are 3 examples of what kind of fraud this program is designed to prevent. Transnational fraud involving stolen identities for durable medical equipment. So in 2025, just a few months ago, authorities uncovered a scheme where a criminal organization used stolen identities to submit fraudulent claims for urinary catheters and other equipment targeting Medicare. 19 defendants, including foreign straw owners and a banker, were involved, resulting in $10.6 billion in fraudulent claims. Also, fraudulent billing for unnecessary amniotic wound grafts. This was discovered and charged in the second quarter of 2024, and this involved two owners of wound care companies and nurse practitioners billing Medicare for unnecessary amniotic wound grafts. The scheme led to $900 million in fraudulent claims. In addition, telemedicine and opioid distribution fraud. In 2023, a nationwide enforcement action revealed fraudulent telemedicine and pharmaceutical schemes, including improper opioid distribution, where the funds were misused for luxury items. 78 defendants were charged with over $2.5 billion in alleged fraud against Medicare and other programs. So, where Medicare Advantage plans may use or abuse prior authorization requirements to enhance average profits per person, Original Medicare is using prior authorizations to stop massive amounts of systemic fraud that are costing Medicare billions of dollars. Looking ahead, starting in January of 2026, Medicare will launch the Wasteful and Inappropriate Service Reduction Model, requiring prior authorizations for a select group of 17 categories of ambulatory service that have been abused or used fraudulently in the past. Ambulatory services are defined as medical procedures or treatment provided on an outpatient basis where the patient receives care without staying overnight in a hospital, such as the clinic visits or diagnostic tests, or when you have surgeries in an ambulatory surgical center instead of in a hospital, or epidural injections. So Medicare's new model uses data and artificial intelligence to target overuse, fraud, and waste. The artificial intelligence analyzes patterns of service utilization to flag potential issues efficiently and to expedite reviews. Now, according to the Centers for Medicare and Medicaid Services, the suspected motivations for illegal overuse include financial incentives in the fee-for-service payments that reward volume over value, defensive medicine, where the doctors order unnecessary tests for their protection rather than your health, or patient demands for more interventions, like when the patients ask for medicine that they saw advertised on TV. Motivations also include gaps in medical training leading to an over-reliance on tests or lack of coordinated care, causing unnecessary duplicates. So, in case you were concerned, I should stress that artificial intelligence assists in the identification of these potential problems, but does not make final decisions. Humans review all suggestions for approvals or denials. The bottom line, with Original Medicare, no one is tasked with reducing your care to increase profits. They're tasked with identifying fraud, waste, and abuse. Most of that comes from people other than the patient. For now, the AntiWaste Model is limited to 17 categories of ambulatory services, so I'd list them down in the show notes below. Geographically, as of January 2026, the program will be limited to Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. Medicare has noted that these states were not selected because there are instances of higher fraud, but rather because they are states where the 17 categories of care occur often enough to generate the data needed to validate and test their model. To be clear, the WISER model is a small pilot program intended to run through 2031. If this program is successful in either reducing overuse of unnecessary services or improving Medicare without increasing costs, then in 2032, it will be expanded both in scope of service and in the states that will be active, or the states within which it will be active. In addition, if the AI model shows itself to be effective, it can also be used to monitor Medicare Advantage plan prior authorizations and to provide real-time reports when such prior authorization requests are not necessary or interfere with the quality of care. And that is a good thing. Lastly, This is a voluntary program. The WISER program does not alter your benefits under Original Medicare. The program targets medical facilities and medical providers, not patients. Unfortunately, you can only opt out by changing doctors to one who is not involved in the program or not using a medical facility that is involved in the program, and that can be difficult. Still, it would take an act of Congress to make the WISER program mandatory. Original Medicare and Medicare Advantage plans can both use prior authorizations, but their intent and objective of prior authorizations are polar opposites. Where one has a history of abusing prior authorizations to increase profits, the other uses prior authorizations to decrease fraud, waste, and abuse, and increase the quality and longevity of Medicare. Please use the comment section below to let me know how you feel about this new Medicare pilot program. Are you in one of the states that will be impacted in 2026? If you found my information helpful, please press the like button below and show your appreciation by subscribing to my channel. I'm Matthew Claassen with Medigap Seminars Insurance Agency. Thank you for watching.